All right, so how do you go about finding a private patient advocate, right? This is a good question a lot of people want to know about. So what I want you guys to do is I want you to go to Greater National Advocates, gnanow.org. That's the best organization, and they have a full directory. I'm listed there. Many of us are listed there. And you can find your state. You can search what type of advocate you want. I don't think the pricing is on there. It's just a free directory that was started by somebody who was actually is a survivor of medical negligence from a hospitalization experience. Has a fascinating story. Check out GNA Now's podcast also. I was on one of their very first podcasts on YouTube where they interviewed me. Being a patient advocate is, again, I'm one of the folks that is in the really beginning of this field. I think it was 2018 when I got certified. At that time, I believe there was probably less than 1,000 people that had even taken the exam to become board certified. Not everybody's board certified, and everybody's needs are different. Sometimes people need a patient advocate because they need non-medical support, like they need billing help, that they may need, other types of medical related assistance and advocacy that is not just directly, oh, I'm in the hospital, I need somebody to advocate for me, or I've got this chronic illness, etc. So there's different types of advocates. Some work specifically with billing, some will negotiate prospective surgeries or anything that you're having upcoming that you might be cash paying for, etc. So make sure you go to GNA, Greater National Advocates. I can't recommend them enough. But good question. How do you go about finding a patient advocate? And there's a lot of fly-by-night organizations. There are some larger nonprofits. I would say also a nonprofit that I'm on the board of. We do not recommend patient advocates, but we do have a lot of consumer-driven services for patient safety, and that is Pulse. So that's Pulse Center for Patient Education and Advocacy. And so you can look up Pulse as well, CPSEA, and also go there and see what kind of free programming we have. We offer 3 to 4 free programs a month where you can just learn more about it. So this is a kind of thing, again, you want to get ahead of before it becomes the crises. So, we probably can expect we're all going to have some medical issue at some point, or somebody in our family will, right? So getting ahead of it, it's like thinking we're not going to, pass away, right? Nobody's going to live forever. So have you planned for that? Do you have your advance directive? I cannot stress enough the importance of having your advance directive done and your medical power of attorney in addition to your financial power of attorney. Those are different documents, and depending on what state you're in, these things do not transfer along state lines for the most part, or not yet, FYI. So if you are a snowbird, you spend time in different states, your medical directive from one state is not going to matter in another state. Now there are laws in every state of who is next of kin, spouse, etc., to make decisions if you lack capacity. But these are things that you can just get ahead of. There is absolutely zero reason to be in a crisis if you plan ahead for your own medical issues. So advanced directives, you can do it online. If you have to get it notarized, that's going to be $20, $10. Can be free if you've got certain memberships. In some states, like where I'm at, it doesn't even require a notary. It's a form that people can fill out online. So become an educated health consumer, because if you're not, then you're just allowing yourself to be, affected and impacted in a negative way when you could be empowered. So these are conversations that have to start early on in families. If you're starting a family now, these are conversations to have with your children as teenagers, as young adults. Again, especially males going to college. These are conversations important to have because young males engage in some of the highest risk activities that ultimately can lead to very significant injuries, traumatic brain injuries. Guys like to drive fast. They like to do high risk activities. They like to get on motorcycles. We call them donor cycles in nursing, by the way, for a good reason. Lots of, young viable tissue collected from young males who ride motorcycles, as an example. So don't let your life become a crisis when there's absolutely no reason to have that happen. Think ahead, plan ahead, be familiar with what your resources are, and let people have a conversation with whoever is your designated person for, whoever you want to designate for your medical power of attorney, obviously financial power of attorney, all those things. But who will make medical decisions for you in the event you are unable to, and who you can convey, here's what I would want done or not want done, right? Like my people, they know Levophed pressors, 5 days max. Intubation, we're not going to do that very long. So, I'm not somebody who wants something super aggressive done if the likelihood of me having a full recovery is slim, because I don't want to be in a fully incapacitated state. That's my personal choice. Everybody has to make your own personal choices. All right. Thanks, you guys. Thanks for listening. Follow, subscribe wherever you're seeing this video. Comment below. Let me know, do you have your power of attorney paperwork put together? Have you ever been to GNA? Let me know. Go to GNA's website. Let me know if you were able to find some resources in your state. You don't necessarily need somebody to be live in person. A lot of this work can be done remotely, so it can be done across state lines. It's not a licensed type of care or services. So there's really no border restriction, even internationally. This can be done internationally. If you travel internationally a lot, it's a good idea to also have a patient advocate, somebody you can call who can help you no matter where you're at. All right, you guys, take care. Be safe out there. Make sure you're taking care of yourself. Think ahead, right? Take care, and I'll see you in the next video.